Today we're going to be discussing IVs. So your patient needs an IV. What does that mean? It means that they need an intravenous catheter. What you need to decide is what type of IV is the most appropriate. Gather your supplies and enter your patient's room and discuss this procedure with them. So let's talk about the different types of IVs. There is a 24 gauge, which is typically used on your neonates. I used 24 gauge needles most frequently when I was working pediatric emergency trauma. Up next, you have your 22s. I always remember it as blue 22. Your 22 is an intermediate size bore gauge, and this is used typically for fluids that are kept on KVO or if you have just maintenance fluids. Your next catheter size up is your 20 gauge, and this is ideal, especially if you're having a patient receiving IV antibiotics or IV contrast. 20s are pinks. Lastly, green 18. Your 18 gauge is your largest size bore, and these are what are used typically in fluid resuscitation and blood product transfusion. And just remember, if you do have a patient who is in a severe code or in fluid resuscitation needs or needing a blood product transfusion, make sure that you always have 2 large bore IV access sites. Some supplies that you're going to need include your J-loop, your saline flush, and an IV start kit. And if your facility does not provide an IV start kit that already has all of the equipment ready in it, here's what you're going to get. A tourniquet. The tourniquet's going to help you best assess your patient's veins. Whether you palpate or visualize or use the assistance of a vein finder, you're going to have your cleaning material. So depending on how you are collecting your sample or what type of sample you're going to collect will determine what you're going to use to clean your patient's skin. Make sure that you have tape, whether it's paper tape or regular tape, some gauze, a transparent and occlusive dressing, and don't forget your label for your catheter, date, and size. Thanks for watching, nurses across the nation. Be sure to keep up with everything on my site at thecalynurse.com and follow me on Instagram at thecalynurse.